How to cure blood clots. Welcome to my channel. Curing blood clots involves a combination of medical treatments and lifestyle adjustments aimed at preventing their formation, managing existing clots, and minimizing the risk of recurrence. From anticoagulant medications and surgical interventions to lifestyle changes and preventive measures, the approach to tackling blood clots is multifaceted. We explore various methods and strategies for effectively addressing blood clots, emphasizing the importance of seeking medical guidance for proper evaluation and treatment. Blood clots require a comprehensive approach that balances medical intervention. Before starting, don't forget to like and subscribe to our channel for more future updates. So, let's start. Number 8. Medication management. Medication management is a crucial aspect of treating and preventing blood clots, such as deep vein thrombosis, DVT, and pulmonary embolism, PE. Blood thinners, also known as anticoagulants, are the primary medications used in this context. Patients must adhere to their prescribed medication regimen meticulously, as consistency is key to controlling clot formation and preventing further complications. Regular monitoring by healthcare professionals is essential to adjust dosages and assess the medication's effectiveness. It's also important to be aware of potential side effects and to promptly report any unusual symptoms. Medication management is a cornerstone of blood clot treatment, improving patient outcomes and reducing the risk of recurrence. Number 7. Lifestyle changes. Lifestyle changes are integral in managing and preventing blood clots, including deep vein thrombosis, DVT, and pulmonary embolism, PE. Maintaining a healthy weight is critical, as obesity increases clot risk. Regular physical activity, such as walking and leg exercises, can promote proper circulation and reduce the likelihood of DVT. Avoiding prolonged periods of immobility, especially during long flights or car rides, is crucial. Smoking cessation is vital because tobacco use exacerbates clot formation. Additionally, a balanced diet low in saturated fats can help control cholesterol levels and support overall cardiovascular health. Lifestyle changes play a pivotal role in reducing clot risk and improving one's well-being. Number 6. Surgical intervention. Surgical intervention is a vital option for managing and treating severe blood clots, particularly when they pose a significant threat. In cases of deep vein thrombosis, DVT, or pulmonary embolism, PE, where medication alone may not suffice, surgery becomes a critical measure. Thrombectomy is a surgical procedure used to physically remove blood clots from the affected veins or arteries. In some cases, a vena cava filter may be implanted to prevent clots from traveling to the lungs. Surgical intervention is typically considered when there is a risk of life-threatening complications or when blood thinners prove ineffective. It's performed by skilled surgeons to safeguard the patient's health and well-being. These surgical measures aim to swiftly resolve blood clots and prevent potentially fatal conditions like pulmonary embolism or stroke. The decision for surgical intervention is made based on the individual patient's condition and the assessment of healthcare experts. Number 5. Elevation. Elevation is a simple yet effective technique in managing blood clots, particularly deep vein thrombosis, DVT, in the legs. Elevating the affected leg helps alleviate swelling, discomfort, and promotes improved blood flow. By positioning the leg above the level of the heart, gravity assists in reducing the pooling of blood in the lower extremities, which can contribute to clot formation. This method is often recommended alongside other treatments, such as anticoagulant medication and compression stockings, to enhance overall DVT management. Elevation is a non-invasive, cost-effective approach that individuals can incorporate into their daily routine to aid in the prevention and alleviation of blood clots. Number 4. IVC filters. Inferior vena cava. IVC filters are medical devices used in specific cases to manage and reduce the risk of pulmonary embolism, PE, which results from blood clots traveling from the legs to the lungs. These filters are surgically implanted into the inferior vena cava, a large vein in the abdomen. They act as a physical barrier, capturing clots before they can reach the lungs. IVC filters are typically considered when anticoagulant therapy isn't an option, has failed, or there's a contraindication. While they can be life-saving, their long-term use is debated due to potential complications. Decisions regarding IVC filters to be made in consultation with a medical specialist. The decision to implant IVC filters is often based on the individual patient's health risks and circumstances, as well as the assessment of healthcare professionals. Close monitoring and potential retrieval of the filter are essential aspects of their use, ensuring that the benefits outweigh any potential risks or complications. Number 3. Compression stockings. Compression stockings, also known as compression hosiery or socks, are a non-invasive and effective means of managing and preventing blood clots, particularly deep vein thrombosis (DVT) in the legs. These specially designed stockings provide graduated pressure, with the greatest pressure at the ankle, gradually decreasing towards the thigh or knee. This pressure helps improve blood flow by preventing blood from pooling and clotting in the leg veins. Compression stockings can reduce swelling, discomfort, and the risk of clot formation. They are often recommended for individuals at risk of DVT, such as those who are immobile, have a history of clots, or are recovering from surgery. Proper fitting and usage are essential for optimal benefits. Consulting a healthcare professional for guidance is crucial to ensure the correct type and pressure level of compression stockings for individual needs. Number 2. Thrombolytic. Thrombolytic, also known as clot-busting medications, are powerful drugs used in emergency situations to treat severe blood clots, particularly those leading to life-threatening conditions like acute ischemic stroke, massive pulmonary embolism (PE), or myocardial infarction, heart attack. These medications work by dissolving the clot and restoring blood flow to affected areas. Thrombolytic are administered intravenously or directly at the site of the clot, rapidly breaking down the obstructive mass. However, their use is reserved for critical scenarios due to the risk of bleeding, which can be significant. Thrombolytic require prompt administration and careful monitoring by medical professionals to maximize their potential benefits, while minimizing potential risks. The timely administration of thrombolytic is essential in such emergencies to maximize their effectiveness and minimize the risk of severe damage. Medical professionals closely monitor patients receiving these medications to ensure they receive the prompt and precise care required to save lives. Number 1. Anticoagulants. Anticoagulants, commonly referred to as blood thinners, are a fundamental component in the management and prevention of blood clots, such as deep vein thrombosis, DVT, and pulmonary embolism, PE. These medications impede the formation and growth of clots by interfering with the blood's clotting mechanisms. Anticoagulants like heparin, warfarin, and newer oral agents, such as rivaroxaban and apixaban, are administered based on the specific condition and individual patient needs. They require careful monitoring and dose adjustments to maintain their effectiveness and reduce the risk of bleeding complications. Anticoagulants play a critical role in preventing clot recurrence and safeguarding overall cardiovascular health, improving patients' quality of life. This is it for today's video. What do you think of our video? Feel free to share your thoughts in the comments section below. Don't forget to like and subscribe to our channel for more future updates. Thanks for watching.